This is a demonstration of log rolling. This patient has a hip fracture, so we're going to show you how to turn a patient properly if they have a hip fracture. You need an abductor wedge or a pillow and a bath blanket for privacy. Remember your beginning procedures and your critical criteria. Good morning, Shelley. How are you? I'm Amber. I'm your nurse. Can I check your ID bracelet? Okay. Today we're going to be log rolling you onto your side. Pull the curtain, have the visitors wait outside the room if you need to. You always need 2 people for log rolling. You can never log roll a patient without the other person. We're going to first lock the brakes of the bed. We're going to either place the side rail up, or if there's another person there, they are the side rail. Okay. We're going to raise the bed to our comfortable working height. Okay. Today we're going to demonstrate, and so for the use of teaching, I'm not going to apply the bath blanket so that you can see what we're doing. So we're just going to uncover the patient. Okay. We're going to say that her right hip, it has the fracture, and it's usually right up over here's the incision. The rules of somebody with a hip fracture is you cannot abduct the leg, you cannot cross the leg. You could set the patient up to 90 degrees, but they cannot be bending more than 90 degrees. So you need to be very cautious of not fracturing that hip again. So the first thing that we're going to do is place the abductor wedge. The narrow side goes up by the patient, and this goes in between their ankles. So the person who has the hip fracture side works while holding the patient's leg. They hold it as a splint. This unaffected leg can go out so that we can bring the abductor wedge in. Okay. All right, so you want to splint the affected side first, and I can just lift up on her leg just a little bit while Marta places the wedge underneath, the straps underneath. Once the affected side is splinted, you can do the other side also. Okay, so that's how you place an abductor wedge. We will also show you how to take it off. Okay, so the same idea goes. You're going to unstrap the strong leg or the unaffected first.